Welcome to the Lifestyle Medicine Update. I'm Dr. James Meschino. A groundbreaking study published in the British Medical Journal in December 2020 showed that consumption of alcohol is exceedingly damaging to human brain cells during 3 critical stages of our lifespan. Now, these include the periods of dynamic brain changes that occur during gestation, which is from conception to birth in fetal life, during later adolescence from years 15 to 19 years of age, and in older adulthood after the age of 65 years of age. So alcohol has long been categorized as a neurotoxin, which means that it's a substance that has destructive effects on nerve cells, including brain cells. We've known that for a long time. But the researchers warn that during these 3 key periods in our lifespan, the detrimental effects of alcohol on the brain are amplified quite significantly. They cite the following data of importance. Globally, around 10% of pregnant women consume alcohol, with the rates considerably higher in European countries than the global average. Now, heavy alcohol use during pregnancy can cause fetal alcohol spectrum disorder associated with widespread reductions in brain volume and cognitive impairment. But the data suggests that even low to moderate alcohol consumption during pregnancy is significantly associated with poor psychological and behavioral outcomes in their children. In terms of adolescence, more than 20% of 15 to 19-year-olds in European and other high-income countries report at least occasional binge drinking. What is binge drinking? It's defined as having 60 grams of alcohol on a single occasion. So one beer or one glass of wine is about 10 grams of alcohol. So this would be at least 6 beers or 6 glasses of wine, as an example, would constitute binge drinking on a single occasion. Studies indicate that the transition to binge drinking in adolescence is associated with reduced brain volume, poor white matter development in the brain, which is critical for efficient brain functioning, and small to moderate deficits in a range of cognitive functions. Now, in older people, alcohol use disorders were recently shown to be one of the strongest modifiable risk factors for all types of dementia, particularly early onset dementia compared with other established risk factors such as high blood pressure and smoking. They're saying getting alcohol reduction is one of the things that can be changed more easily. Although alcohol use disorders are relatively rare in older adults, the authors point out that even moderate drinking has been shown to be linked to a small but significant loss of brain volume in older subjects. Now, after the age of 60, your brain volume is shrinking at least 0.5% per year. So having alcohol, even on a moderate level, is going to speed up the atrophy or shrinking of the brain. As well, demographic trends may compound the effect of alcohol use on brain health. For example, women are now just as likely as men to drink alcohol and experience alcohol-related harm, and global consumption is forecast to rise further in the next decade. Now, the effects of the COVID-19 pandemic on alcohol use and related harms are unclear, but alcohol use increased in the long term after other major health crises. So we think that during the pandemic, there's likely to be even more alcohol consumption. As such, the researchers call for an integrated approach to harm reduction at all ages. So they state, and I quote, "Population-based interventions such as guidelines on low-risk drinking, alcohol pricing policies, and lower drink driving limits need to be accompanied by the development of training and care pathways that consider the human brain at risk throughout life due to alcohol exposure." End of quote. Remember that alcohol consumption is also the second most common environmental cause of cancer in our society after cigarette smoking, accounting for an estimated 3.5% of all cancer deaths in the United States each year. So I've included the reference for this research paper in the text below. Thanks for watching, and I'll see you next time.